Unitec has been collaborating with the hospital for more than 16 years to valorize innovation. Innovation at the hospital is very specific because most of the employees have the capacity to identify a medical need and find a solution. The solution developed by Olivier and Nicolo at the CMU is the result of a very good collaboration between fundamental research at the Faculty of Medicine and the clinic at the hospital to develop a medical device. So this project has been supported by Unitec and financed by INNOCAP, which is the proof of concept funding of the Université and the hospital. If this technology works, it would be what we call an innovation from bench to bedside.
So a chronic wound is a wound that doesn't heal in a proper amount of time. Chronic wounds is a very serious medical situation and is associated with a chronic pain, and sometimes require even some extreme surgical acts such as amputation. So chronic wound develops in several pathological conditions. We can think about diabetes or venous insufficiency, and represent a real problem because of our aging population and the prevalence of this disease. So chronic wounds are also relatively frequent and are associated with increase with the real economic and social burden. We can think that in the hospital we have around 500 patients that need per year to be treated for chronic wound care, and in the United States we can estimate that 4.5 million people are affected by chronic wounds.
A subtype of stem cells present in our body represent an attractive tool for the treatment of chronic wounds. These cells has the advantage to produce a large amount of healing factors. Based on these cells, we have decided to produce a patch that will combine different components. The first component will be a sponge that is biocompatible with the patients. We have introduced the cells, the stem cells within the sponge to produce a patch secreting the sweated healing factors. And we plan now, in collaboration with the hospital, to test this patch directly in patients.